My name is Professor Amy Brown and I'm Director for the Centre for Lactation, Infant Feeding and Translation. Our project was looking at developing the work of our research centre, the Centre for Lactation, Infant Feeding and Translation. And as part of that, we were lucky enough to form a collaboration with the Human Milk Foundation and Swansea Bay University Health Board to set up Wales's first ever donor human milk hub. Donor milk is life-saving for sick and premature babies, but until our project, Wales didn't have its own donor milk hub or bank. We brought in donor milk from England for our neonatal units to use with those most vulnerable babies. But our project has enabled a hub to be set up at Singleton Hospital in Swansea. This means we have a much bigger storage facility to bring in more milk so it can be more easily accessed by local hospitals. But what it also has meant is that mothers in the local area in South and West Wales are able to donate their milk for the very first time. We know from the research that we've been doing alongside our project that that can make a real difference to those mothers in terms of their mental health and often being able to give back to a system where they receive donor milk for their own baby. This can have a huge sense of pride for them, a sense of belonging, a sense of being part of a community. And we've got a very special group of mothers who donate their milk after their baby has sadly passed away. For these mothers, it feels like they are leaving a legacy for their baby. And to know that our project has enabled that is really life-changing for us as well. The HEFQ funding has enabled us to do so much. At the start of the project, we were able to employ a senior research officer, Dr. Amy Grant, who worked on developing research projects and on bringing in new funding. As part of that, she was lucky enough to be awarded a 8-year, £2.4 million fellowship to explore autistic experiences of reproduction. In terms of our hub, quite simply put, without the HEFQ funding, Wales still wouldn't have its own donor milk hub. Women wouldn't be able to donate and to benefit from that. Our communities wouldn't have been able to benefit from the experience of supporting the hub, and hospitals would have found it much more difficult to access donor milk for the babies. Our project is going to go further. The HEFQ funding has allowed us the time to develop further relationships with Welsh Government, with Public Health Wales and with other organisations. And we're going to continue building on the work of the hub, hopefully to develop it into a much larger project that runs across Wales.